Hello, welcome back to Future Ahead, and today we are going to continue our series all about approaches in psychology and how we can go about different therapeutic interventions. So, EMDR. So that stands for Eye Movement Desensitization Reprocessing. It was invented by Francis Shapiro back in 1987 because she was out for a walk thinking about her own distressing negative emotions and memories when she realized that actually her eye movements were decreasing the negative emotion associated with these memories. She felt more relaxed and less distressed. And so, when she realized this, she decided to get 22 participants with traumatic memories to take part in a little experiment to see whether eye movement desensitization reprocessing could truly be a therapeutic intervention. So here she halved those participants into two conditions. One of those conditions were just having positive imagery, and positive descriptions taught them throughout remembering their distressing and traumatic memories. Whereas with the other group, they were told to move their eyes whilst thinking about their traumatic memories. And they then rated the level of disturbance associated with these memories and found that there was a significant decline in the rating of disturbance in the eye movement group compared to the imagery and descriptions group. So let me break down the 8 steps of EMDR. First of all, we're going to go through history taking. So we're going to go through any sort of experiences that the patient might have had, or the client, as you will. We're going to talk about how they feel about their household members, how they feel about their life thus far, how this is affecting them. And once we've done the history taken, we know that the client is fit and well, we're going to prepare them for EMDR. So, generally, people with issues with their eye movement, people with epilepsy, they're not really suitable for EMDR. So, we also need to cover those aspects of whether this is the right patient to take on this type of therapeutic treatment. Once we are in the preparation section, we're going to tell them some relaxation techniques. We are then going to assess the patient using the different rating scales, and then we're going to get into the process. So I'm going to go through the process more thoroughly in the next few slides. So now we're going to go ahead and talk about the process. So the process, of course, first involves a traumatic memory. So we call that the node. The node may be a certain part of the memory in which it comes up as a flashback to us quite often. We're going to notice everything about that node. So the imagery, the sensations that come up, and we are going to then rate this node on a scale of subjective units of distress. So we call this the SUD scale, and we rank this on a measurement of 0 to 10. So the aim of EMDR is to get that from higher end of the scale down to the lower end of the scale until we associate our node with less levels of disturbance. I know that sometimes therapists only allow first-time clients to begin with nodes that are around a 7 or 8, depending on their circumstance and depending on if they feel the client's capacity can handle maybe a higher subjective unit of disturbance. I just know that a lot of therapists do this for ethical reasons to make sure that their client truly can handle the therapeutic process. So, whilst we're talking about these levels of disturbance, we're too going to talk about the affect. So, any negative emotions that come up when we think of this memory, how it does just generally make us feel and think. But thinking is on to the next slide. So, we're going to talk about whether this gives us any negative beliefs. So, when we think of this memory, what transpires? For example, if I think of a memory where a particularly vulnerable, terrible moment happened, and the influence of this is I feel awful, and therefore I feel that I must be alone, that I can't speak to anyone, that I'm a loser. And we're going to think about what we would like to instead believe by focusing on a positive belief. So after thinking of the negative beliefs, we just think, what would I like to replace this memory, this thought with? And then we subjectively measure this too on a VOC rating scale. So, what is the VOC rating scale? It is the validity of cognition, and we rate this one from 0 to 7. So, quite often, because at the start of the session we've only just conspired this positive belief that we would like to have, it will be on the lower end of the spectrum. And the aim of EMDR is to get someone's positive belief rating up to around a 6 or a 7, and they will continue sessions until the subjective unit of distress scale is a lot lower in the zeros to ones. Quite often, we won't stop sessions until we reach a 0. However, sometimes clients are okay with leaving it around a 1. And for the rate of the positive belief, we aim to make that around a 6 or a 7. One thing that EMDR does remember is that the body keeps the score, so we do hold trauma in our bodies. And so the practitioner is going to ask whether there are any bodily sensations that arise when we think of this node, this memory. So at first, when the level of disturbance is quite high, they may say they feel a awful deep-seated feeling in their stomach, and then by the end of the sessions they say, oh, actually I feel maybe a tingling in my spine, a more positive bodily sensation. So, all of that is just the debrief that goes down at the start of any client session. And we do continuously ask them to check in on these rating scales throughout the session. However, the session hasn't truly started until we get on to the finger movements. So the aim here is to have the client follow the fingers with their eyes as fast as they possibly can in a sense that's comfortable for them. And these are supposed to be fluid movements that go completely horizontal from side to side for around 20 seconds at a time. So that would usually look like around 22 to 25 side to side movements. And then you stop, allow the client to relax, ask them what they think of, allow the client to say whatever comes to mind, say, stay with that, and then continue. So, after completing a set of hand movements, often the therapist is going to intervene and just ask on the subjective units of distress scale, how is that node feeling now? How are they rating it on a 0 to 10? They're going to check in, and then they're going to ask, how about the positive belief? So they're going to look from the VOC scale, how is it rating on a 0 to 7? After asking about the ratings and after checking in, therapist is once again just going to say, stay with that and get back to the finger movements. So quite often EMDR sessions will last around 1 hour, and by the end of that hour you should hope that your client has gotten to a much lower end of their scale. So once we've got more belief in the positive belief and we're scoring higher on the VOC scale and we're scoring lower scores on the SUD scale, we're going to focus on the bodily sensations. So at the start, we're going to have taught our clients some relaxation techniques, including deep breathing, and then we're going to teach them about the butterfly hug. So for the butterfly hug, we cross our thumbs in order to shape a little butterfly, put them right under our collarbones, and when we're trying to clear those bodily sensations, the client's going to continue to think about the traumatic memory, and they're going to tap it out hand by hand, once again stimulating each side for at least a set of 8 at a time. And what you may notice is while certain sensations are going on within your client, they may pause for a second, but just let it be. Allow them to continue to deeply breathe as they go through the motions, and eventually the bodily sensation should also lessen. Okay, at this rate, you may be thinking, I know what to expect, I know how to do it, but why does it work? How does it work? Like, why is this a thing? Why did these eye movements actually calm me down, reprocess trauma? So let's get to it. Our brain has two sides, and when we stimulate both sides, it relaxes our nervous system. So, usually, when we think of a traumatic memory and it's not yet integrated, it triggers it. Our brain has two sides, and when we stimulate both sides, it relaxes our nervous system. So, usually, when we think of a traumatic memory and it's not yet integrated, it triggers it. A fight or flight response. We don't know how to cope with it, we don't know how to adapt, and so we stay in that fight, flight, or freeze mode because our sympathetic nervous system is activated. However, humans have evolved so that when we engage of bilateral stimulation of the brain, a fight or flight response, our parasympathetic nervous system is then activated. This means that we can then calm down. This is the same nervous system that's active, for example, when you're relaxing or when you're sleeping. And so, through activating this nervous system, we are able to soothe ourselves, thinking of these memories, and reintegrate them. So, thank you for coming to my bite sized lecture on EMDR and sort of how and why people might get it. Uh, Today we went over the biological reasoning for EMDR, but if you want to find out all about adaptive information processing, the cognitive basis that it's based on, then feel free to go over to my more in-depth lecture on that. Thank you, and please give a like, sub, and subscribe.